120, 121. Come on, Oscar. Come on, you old boy, you can't hack it. Ah, anyway, I might as well just teach you something about the muscles now since you can't use yours anymore. So, myology, myologie. I guess I did that in French, but it's muscles of the elbow. So, what are the principal flexors of the elbow? The biceps, the brachialis, and the brachioradialis are the main ones. And you can see that the biceps and the brachialis are mostly innervated by the musculocutaneous, which is C5, C6, small branch of the radial in the brachialis, and the brachioradialis is the radial C5, C6. So you can start to think in terms of differentiation. If you have something that is more of a nerve root, perhaps you might have a problem in all of those muscles. If you're thinking more of a peripheral nerve, then maybe, for example, if it's more musculocutaneous, maybe you'll have a problem in both the biceps and the brachialis. Or if you're thinking more of a single muscular lesion, then you can differentiate by the actions of these muscles. Hence, the biceps would be more of a supinator, brachialis pure flexor, so we can change the way we have the position of our forearm, and the brachioradialis would be more in neutral. We also have the pronator, the flexor carporadialis, so palmaris longus, and the flexor carpi ulnaris. So you see these muscles down here play a role on the wrist as well. And so we have some that are from the median nerve, and then the flexor carpi ulnaris is the ulnar nerve. And just so you can see here we have the coracobrachialis, which is going from the coracoid only down to the humerus. So it will have a role on the shoulder, not on the elbow. And then we have the two parts of the biceps, so the long tendon and then the short, coming to combine in here to insert onto the radius. And we also have the brachialis, which is deep to that. And then, of course, the brachioradialis we can see here. So the brachioradialis, the brachialis, the biceps tendon, and the artery, which those did not go in the order that was supposed to. This is obviously the brachialis, and this is the biceps, and this is the brachial artery here. And just to note that if you're going to be doing palpation in the children, you can come medially here. You can feel medially along the biceps to try to find the pulse with the brachial artery. Here's just a look at the parts of the cubital fossa as well, and we'll look at the different nerves individually after, and you can see how the brachial artery comes down on the medial side, but then we'll go more on to the lateral side, and in the vascularization, of course, that will split between the ulnar and the ulnar and then the radial artery. The cubital fossa, the boundaries. So medially, you have the pronator teres. Laterally, you have the brachioradialis. Proximally, it's the two lines between the epicondyles, and the floor is the supinator and the brachialis. And then the contents. So whenever you're trying to remember things like this, try to think in a logical way. So either maybe go medial to lateral or lateral to medial. I chose to go medial to lateral. So first of all is the median nerve, and the median nerve is here. And then you have the brachial artery. Then you're going to have the biceps tendon next. And then you're going to have two other nerves. You're going to have the radial nerve, and then you're going to have the posterior interosseous branch of the radial nerve as well. What are the main extensors of the elbow? Well, we have the triceps, which is the radial nerve C6 to T1, and the anconeus, which is also radial C7 to C8. Now, just take note here that the anconeus goes from the lateral epicondyle, and it will go from the epicondyle, and it's going to go down toward the ulna and the olecranon. So when you're thinking about it, see if you can do transverse frictions. It can often be something that limits the flexion of the elbow, or there's tightness in the lateral or lateral posterior elbow. And the triceps we see here, we see the long head, which acts on the shoulder as well because it attaches onto the scapula, and then the lateral head, and then we have the medial head, which is a little bit deeper. We have supination and pronation. Here is an example of the supinator, and you can see how it goes from the posterior side of our radius, and then it englobes it. And so if we want to go from pronation and into supination, it's going to come around and it's going to bring our radius around back to the lateral side. And then we see the two pronators, the pronator teres here, and then we see the pronator here, and we'll see them in detail, but you can see how there are two heads of the pronator teres, one coming off the ulna and one coming off the humerus, and that can be an area of entrapment. So the pronator muscles, we have the brachioradialis, but more so the pronator quadratus, and the flexor carpi radialis. Now, keep in mind, if you look, later we'll look at the common flexor tendon, but the muscles going from the medial side of the elbow going toward the lateral side as they go distally, they could all be muscles that do pronation, which you can think in the reverse, they also might be muscles that might limit some of the supination. So what are the supinators? The biceps, and then the brachioradialis, again, Bolin, depends. Of course, we consider it more of a flexor of the elbow in neutral. And then the supinator, which is radial C5, C6. So that's where we might be able to differentiate between the two muscles if there is a neural lesion or an individual muscle lesion. And as I said about the flexors, if you've got, we'll look at the common extensor tendons, but if they are going from lateral more toward the medial, then they will also do supination and also could limit pronation. So the supinator muscle, it goes from the lateral epicondyle of the humerus, the radial collateral ligament, and the annular ligament. So it's got quite a bit of attachment on the lateral side of the elbow. Oops. And the insertion is proximal, 1/3 of the lateral surface of the radius, and the innervation is the posterior interosseous nerve. So the common flexor tendons, how to figure out how many and what we've got. So my trick is to remember them is how many fingers do you have? I have 5. I think everyone in the class had 5. We're going to go with that. So if you take the heel of your hand and you put it on the medial epicondyle and lay your hand down, you've still got 5 fingers, but what you're going to have is the 5 common flexor tendon muscles. So the one that's most on the medial side is going to be your flexor carpi ulnaris. Then you're going to have the flexor digitorum superficialis. Then the one that's heading down the middle is going to be your palmaris longus. And here you're going to have the flexor carpi radialis. And then the thumb is going to represent your pronator teres. So that's my little trick for remembering them. And that's sometimes what you have to do in anatomy is find things to remind you. So flexor carpi ulnaris, I said part of the flexor superficialis because there is a part of it which comes off the coronoid from the ulna, the pronator palmaris longus, and the flexor carpi radialis. The common extensor tendon, there are 4 muscles. We have the extensor carpi radialis brevis, not the longus, but the brevis, the extensor carpi ulnaris, the extensor digitorum, and the extensor digiti minimi. So first, if we look at the common flexor tendon, we have the pronator teres, we have the humeral head. There is a bit of attachment of the pronators just proximal on the humerus itself. The flexor digitorum superficialis, the humeral ulnar head, and then the flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. And this is just an example of how you can lay your hand down and figure it out yourself. And then if you look at this as well, this is what we just did, and this is how you can see the muscles. The brachioradialis, of course, is not part of that. Now, if we look at the common flexor tendon, this is just so you can see the flexor carpi ulnaris, the palmaris, and the flexor carpi radialis. They are in one muscular layer. And then we have the flexor digitorum superficialis, and it goes between the two bones, but it starts in the common flexor tendon. And like I said, there's a little attachment on the proximal anterior surface of the ulna on the coronoid. Other muscles coming from the medial side, like I said, the pronator, it's got the two heads, part of it coming from the common flexor tendon. And the flexor digitorum profundus is not part of the common flexor tendon. It starts on the ulna and comes down into the hand. And here, so you can just see examples of the different layers. And this is what I was saying, there is the flexor digitorum superficialis and the pronator, and then the abductor longus here of the thumb, which all come off the anterior surface of the ulna, which you can palpate those insertions, or origins, I should say, when you've got a problem more distally. So this is a nice cadaveric sampling of the common flexor tendon. So if we look at this, let me see, I'll put myself up there. So here are the flexor carpi ulnaris, the flexor digitorum superficialis, the palmaris longus, the flexor carpi radialis, and the pronator teres. But here you can see the insertion or the origin of the flexor carpi ulnaris from the ulna, but here you can see it's got some fibers that go up into the common flexor tendon as well. So the common extensors, extensor carpi radialis brevis, extensor carpi digitorum, extensor digiti minimi, and extensor carpi ulnaris. We also have the extensor carpi radialis longus coming from the lateral side, but it is not part of the common extensor tendon. So to repeat, the extensor carpi radialis brevis, extensor carpi ulnaris, extensor digiti minimi, and extensor digitorum are all part of the common extensor tendon. From distal to proximal on the lateral supracondylar ridge anteriorly, what comes off of that? The supinator, the extensor carpi radialis longus, and the brachioradialis. That's proximal to distal. So the first is the supinator, and going upwards is extensor carpi radialis longus and the brachioradialis. And the posterior aspect of the supracondylar ridge are the anconeus and the triceps. And here's a good view of the anconeus going down and anteriorly. So if you need to figure out which way to friction it, then you have to go perpendicular to those fibers. And hiding underneath there is the supinator. Thank you. It's not the end of elbow anatomy. You can keep learning.